I think we're now at a stage where we can confirm a lot of what we'd suspected for the last 10 to 15 years, which is that oral therapy for hepatitis B significantly impacts outcomes. In the early days of oral therapy, we could demonstrate suppression of the hepatitis B virus, clearance of E antigen, and sometimes surface antigen. What has emerged over the last few years is definitive evidence that we're altering important long-term complications of liver disease, including hepatocellular carcinoma. We now have definitive studies indicating that we can anticipate regression of fibrosis and even of cirrhosis with effective long-term therapy of hepatitis B. This in turn has translated into a lower incidence of hepatocellular carcinoma and overt hepatic decompensation. So it's now possible for with an individual patient using one of the first-line oral agents, that is either entecavir or tenofovir, to favorably improve the patient's long-term prognosis. And I think the data is now very convincing in this regard. I would like to draw your attention to two seminal studies. The first is by Marcelin. It was reported earlier this year in the Lancet. In essence, it was a long-term study of patients with chronic hepatitis B infection who received tenofovir therapy over a period of several years, and who had liver biopsies performed. On serial liver biopsies, there was clear regression of fibrosis, and what was even more remarkable was that some patients who were cirrhotic at entry had regression of fibrosis such that they were cirrhotic no longer. And in this particular study, there appeared to be a decreased risk of hepatocellular carcinoma as a result. The other recent important study is by Hosaka and colleagues from Japan, which looked at the impact of long-term entecavir therapy in the incidence of hepatocellular carcinoma. They had appropriate untreated controls from the pre-therapy era. And again, this study demonstrated convincing reduction in the incidence of hepatocellular carcinoma with long-term oral antiviral therapy. So we now have two very well-conducted and important studies which clearly show that we can improve outcomes and reduce complications in patients with chronic hepatitis B infection with these oral agents, which are well tolerated and really have very few side effects.